You know that feeling, right? That sudden ache, that weird ringing, or just a sense of fullness in your ear. It's so easy to just brush it off. But what if your body is actually trying to send you a message? Well, today we're going to decode those signals. So yeah, let's grab our magnifying glass and start the investigation. Okay, think of it like this. Your ear is a crime scene, and any new symptom? That's your first clue. An ache, maybe some drainage, a change in your hearing. These things are not random. Nope, they're all pieces of a puzzle. And our job today, it's to play detective and figure out what these clues are really telling us.
So before we can solve any mystery, we gotta know what we're looking for, right? In this first section, we're gonna gather our evidence. We're gonna identify the primary clues our ears can give us.
All right, so here they are, our 5 main clues. You've got ear pain, which doctors call atalgia. Then there's ear drainage, or otorrhea, hearing loss, itching, and of course, that plugged-up feeling of fullness. You really can think of these as the fingerprints left at the scene. Each one can point us in a totally different direction, so let's zoom in on a couple of the most important ones. Okay, first up, otalgia. That's just the fancy medical term for ear pain. But here's what's so fascinating about ear pain. It can be referred. What does that mean? It means the problem might not even be in your ear at all. No way. The pain could actually be coming from a toothache or a sore throat. You know, the body's wiring is super complex, and it's like sometimes the alarm bell rings in a totally different room from where the fire is. Wild, right? Next up, we've got otorrhea, which is just ear drainage. Now, this is a huge piece of evidence in our investigation, a really big one. Because not all drainage is the same. Is it cloudy? Is it bloody? Or is it perfectly clear? The color, the consistency, all of it can tell a doctor a ton about what might be going on inside. Everything from a simple little scratch to something way more serious.
All right, so we've got our list of clues. Now for the fun part, connecting the dots. Let's dive into our next section and see how we can link these symptoms to some of the most common causes, or, as we're going to call them, our usual suspects.
Okay, let's start with a classic scenario. Let me ask you this. You've got ear pain, right? And it gets way worse when you, pull on your earlobe. And maybe you just spent the day at the pool or the lake? If you're nodding your head right now, well, I think we're closing in on our first culprit. And yep, these clues point to 2 very different suspects. On one hand, with that pain on the outer ear, we've got otitis externa. You probably know it as swimmer's ear. But on the other hand, with that deep internal pain, that's otitis media, a classic middle ear infection. You see it a lot in kids after they've had a cold. This really shows that where you feel the pain and how you feel it, that's absolutely everything when it comes to cracking the case.
All right, let's try another one. Forget swimming for a minute. Instead, picture this. You're on a plane, it's starting to land, and bam, this sharp, intense pain just hits your ears. Or maybe you're a scuba diver and you felt it after coming up from a dive. This set of clues, this points us to a completely different cause.
Yep, this is a classic case of what's called barotrauma. And really, it's all about pressure. The number one symptom is pain that's directly linked to those changes in altitude or depth. You might also get some hearing loss, that ringing sound, or even feel dizzy. And discharge? Well, that only happens if the pressure change is so bad that it actually ruptures the eardrum.
Okay, one last scenario for this section. This one, it's less about that sharp, sudden pain, and more about a nagging feeling. You know, your ear just feels blocked. Sounds are kind of muffled, and it seems like it's slowly getting worse. So what could be causing that?
And, more often than not, the answer is pretty simple. Impacted earwax, or cerumen. It doesn't usually cause pain, not unless it gets infected anyway, but it is a huge reason for that feeling of fullness and that gradual loss of hearing. It's basically a traffic jam happening right inside your ear canal.
Okay, so we've looked at infections, we've looked at pressure, and we've looked at blockages. But what if the real cause of your ear trouble isn't in your ear at all? In this next section, we're going to uncover a really surprising connection, one that a lot of people totally overlook.
That's right. I mean, what if that hearing loss, or the ringing, or the dizziness you're feeling, what if it's actually a side effect? A side effect from a medication you're taking for something completely, totally unrelated. This phenomenon actually has a name. It's called ototoxicity, and it literally means ear poisoning. It's when ear issues are directly caused by a drug. Now, this is a critical clue because it means the culprit, well, it might already be sitting in your medicine cabinet. And what's really surprising is just how common some of these medications are. I mean, take salicylates. That group includes something as basic as aspirin. Now, high doses can cause that ringing sound, tinnitus, but thankfully it's usually reversible. The same thing can happen with certain common antibiotics and diuretics. So the most important takeaway here, the thing to really remember is this. If you start a new medication and you suddenly notice ear symptoms, that connection is absolutely worth bringing up with your doctor or pharmacist.
Wow, we've covered a lot of ground, haven't we? From infections to side effects. But honestly, the most important part of this entire investigation is knowing when to stop playing detective on your own and when to call in a professional. And that brings us to our final, and I'd say most critical, section. And when it comes to ear pain, there's a really clear rule of thumb here. The source material puts it plainly. If pain lasts more than 2 to 3 days, refer the patient for medical evaluation. The message couldn't be simpler. Don't wait. So, let's just sum it all up. Here's your final checklist. I want you to think of these as the absolute red flags, okay? Number 1, pain that just won't quit. 2, any bloody or clear drainage from the ear. 3, a sudden, unexplained drop in your hearing. And 4, new ear symptoms right after you've started a new medication. If you check any of those boxes, the verdict is in. It's time to call a professional. At the end of the day, our bodies are constantly communicating with us through all these symptoms. The aches, the pains, those strange new sensations. It's all data. They're all clues. So the only real question is, are you ready to listen? Thanks for joining me on The Explainer.